is a genetic disorder that is devastating to a life, but so rare that it is normally unheard of. My nephew Tyler was born May 2nd of 1998. He started losing milestones at about 10 months of age. He underwent testing for many months, and at about 15 months old, he was diagnosed with Sandhoff's disease. My sister soon found out she was pregnant again, and she was worried that her daughter would have the same disease. My niece Madison was born August 4th of 2000. At 3 months old, Madison was diagnosed with Sandhoff's disease as well. Today I'm sharing with you the story of my niece and nephew in hopes of raising your awareness of a destructive disorder called Sandhoff's disease. I will be talking about the causes, the symptoms, and potential treatments for this disease. I'll begin by telling you about Sandhoff's disease and how it affects the body. Sandhoff's disease is a genetic lysosomal storage disease, according to the National Tay-Sachs and Allied Diseases Association's website. Infants are born missing two essential enzymes that break down fatty acids within their cells. The acids begin to build up on the nerve cells. The messages relayed from the brain to the nerves start to slow down, and the messages eventually come to a stop. Sandhoff's disease is transmitted through an autosomal recessive trait. Both parents have to be carriers of the disease in order to have a child to be born with this disease. There is a 1 in 4 chance that each child will be born with this disease. And if the child only inherits one recessive gene from the parent, then they are considered a carrier. And before having any children, the carrier's partner should undergo genetic testing to see if he or she is also a carrier. Sandhoff's disease is most common with people from the French-Canadian background. Now I'll talk to you a little bit about the signs and symptoms of Sandhoff's disease. Children with this disease are born healthy with no visual signs or symptoms or complications. At about 4 months of age, the affected children begin to show an exaggerated startle reflex to sudden sound or movements. Between 9 to 12 months, children begin to lose any milestones which they have learned. Children are unable to sit or roll over anymore. Sometime around 12 months of age, seizures begin. They start out infrequent, but eventually they become an everyday event. Medications to control the seizures are often introduced at this time. And even with correct levels of medication, the seizures are never fully controlled. At about 15 months of age, the swallow reflex begins to weaken. As the child eats, they may aspirate food, which puts them at risk for infections or pneumonia. The option of inserting feeding tubes is normally addressed at this time. Without the ability to swallow, saliva begins to collect in the throat, which requires suctioning. Suctioning can range from a few times a day to many times per hour. Between 2 to 3 years of age, children with Sandhoff's disease become blind and paralyzed. Due to the accumulation of the fatty acids in the child's body, the nervous system and most muscles become deteriorated. The lifespan of children with Sandhoff's disease is about 3 years. These children usually lose their battle due to a respiratory infection. This disease is not necessarily a painful one, and children with it spend most of their time resting peacefully. Due to the rarity of this disease, there has not been a lot of research done to find a cure. So I will talk about a few of the potential treatments for this disease. Although there is no cure for Sandhoff's disease, there are a few hopeful options. The first is a stem cell transplant. Stem cells are collected from a donor. The patient is then given chemotherapy to suppress their immune system. Stem cells are then introduced to the patient, and new stem cells recognize what the body is missing, and it starts to create them. Unfortunately, these stem cells can't pass through the blood-brain barrier where it is needed the most. This transplant is not a cure, but as in my niece's case, it did successfully double her lifespan from 3 to 6 years old. The second treatment is that of gene therapy. Scientists would genetically alter a non-lethal form of a virus, such as meningitis. The stem cells will be injected into the virus, and the viral cells holding the stem cells are then injected into the immunosuppressed patient. The virus is then able to pass through the blood-brain barrier and deliver the stem cells. Stem cell replication then occurs, and stem cells create the missing enzymes, which then break down the fatty acids and therefore cure the child. Unfortunately, gene therapy is not currently being used to treat children with Sandhoff's disease, but hopefully this will soon be a routine treatment to cure these children. Today I have talked about Sandhoff's disease, to advocate for these children and to try to raise awareness in hopes that someday a cure will be available. Before having family members affected by this disease, I'd never heard of anything like it. It's very scary to know that in our genes lies something so powerful that it can control and take a life just as quickly as one was brought into this world. My hope is that not another child will have to go through what my niece and nephew did.